Beatrice Elachi, where does this leave us? If the Auditor General comes up with this report, and ordinarily Parliament is the primary consumer of such reports, so then what?
Well, you see, Sam, one thing I've come to realize in our country, we are very interesting people, yeah? Mm-hmm. And I'll just say what I said in Parliament. You see, it is important. I think the people who have the idea, this universal healthcare, yes, really, every president has really tried to push this thing. Fine. So we are here now. But then the question now that I will ask, which I think the person who will be good to answer is the MOH accounting officer, who is the PS.
Yep.
Number one, when you hear the Auditor General, then you come and ask yourself, is the system a service model where we are leasing the way we did the first project when I was in Senate of leasing equipments? Is it that model? After he answers that question, then you tell them. So it is, in a layman's way, I will say it's like the expressway. Because when she says the monies must go somewhere, it means government did not remove any money. There are people who have serviced this thing, and you need to pay them as Kenyans for you to use this ecosystem that I see was so large that either carries the facilities, carries the devices, carries connectivity, carries every storage, cloud, all those things. And then the person who has been given this responsibility, who they trusted, I'm trying to think through, Sam. So it's just...
Carry on.
It's Safaricom, because it's the largest connectivity internet company that we have, that has internet, that has infrastructure. But the question now will come back after that is that after they took Safaricom, we have leased the service, the best they would have done, and this now, and I'm sorry, it brings in very many other agencies of government, because the AG also is there to say he advised before you even arrive at Treasury to say now you are being given a leeway to use what in the Procurement Act, which is legal, because they used one of those options we have given on how to procure. So, and then you ask yourself, so who runs the registration platform? Who is this person who is running the operations where Ministry of Health has roughly 19 institutions? Are they on this platform? And I'll give you an example. Did they want to try to do what now Governor of Murang'a is doing?
What 19 institutions?
Well, we have KEMSA, we have NKNH, we have all those. Are they part that they will benefit on this magnitude system that I asked in there? I'm asking the same questions I asked Pokose one time when we were doing this in the House. That you see, you need to clear people's minds to understand. And so even when the Auditor General is coming, so who is the internal auditor of MOH? Because before she brings out this, definitely I know her team walked in and they asked. And for her, it means...
But wait, Mheshimiwa, and sorry to cut your trail of thought. The Auditor General and also the internal auditor, they come in after the fact, if I'm not mistaken.
No. The internal auditor, why I have employed you as an internal auditor, is to help me to guide whether my systems are functioning before the external auditor comes and audits me.
What I'm asking is, does the internal auditor audit the procurement process, or they wait for you to conclude, then look at it?
You see, them, they have an opportunity. That's why we call their internal, they are ours. When we are continuing with the process, our legal teams that are within our institution are supposed to be guiding us, isn't it? They are guided, then they go to the AG, they ask, the AG also gives his own external advice of what he feels, whether it is right or wrong, where you are headed, and you keep those reports. Then now the internal auditor, after you have done, but before it even comes out, he comes in and he audits. And he tells you. That is why you'll find sometimes...
the problem with the internal auditor or the procurement...
No, I'm not saying that, no, it starts from the procurement.
Right.
So I cannot say the problem is internal. I'm just saying, for her to pick now that, she's picking it from the reports that themselves, MOH, have already produced. So it means, did you advise your clients well? Or what was the problem? Or they did not want to hear? So if those are all the questions we are going to ask, then we shall say, from the process beginning of the whole thing, there's somewhere each one of you, do I say we're sabotaging each other? Yeah, because, but one thing we need now to understand as Kenyans, the model. You know, the moment we understand the model, we'll stop talking to government and we'll start looking for who are now the owners.